Have you noticed dark spots, itching, or unusual dryness on your skin? These could be silent signs that your body is trying to warn you about something very serious: diabetes. Diabetes is a disease that affects millions of people worldwide, and its symptoms are not always obvious in the early stages. Before it impacts organs like the kidneys, heart, and eyes, high blood sugar levels can leave visible clues on your skin. These changes are easy to overlook, but if you know what to look for, you can take action in time and prevent more serious problems. In this video, we will reveal the main signs diabetes can leave on your skin, how to identify them, and what to do if you notice these changes. If you care about your health or know someone at risk, stay with me until the end. This information could be the key to detecting the disease early and ensuring a healthier future. Why does diabetes affect the skin? The skin is the largest organ in the human body and is often the first to show signs that something is not working properly internally. In the case of diabetes, high blood glucose levels can trigger a series of subtle yet significant changes in skin health. These changes occur because diabetes affects circulation, the immune system, and the body's ability to regenerate. When glucose levels remain high, blood vessels start to suffer damage. This affects the transportation of oxygen and essential nutrients to the skin, making it more fragile and vulnerable to infections, dryness, and slow healing. Additionally, diabetes also alters collagen production, a key protein for skin elasticity and firmness, which can lead to changes in its texture and appearance. Another important factor is insulin resistance, a common condition in people with prediabetes and type 2 diabetes. This resistance can cause skin thickening in certain areas, resulting in dark, velvety patches, especially in folds like the neck and armpits. All these changes may seem harmless at first, but they are clear signs that something is happening inside your body. The good news is that recognizing these symptoms can be the first step in acting before diabetes progresses and causes more serious damage. 1. Dark, velvety patches. If you've noticed darkened areas with a velvety texture on your neck, armpits, or groin, this could be one of the first signs of insulin resistance. This condition is known as acanthosis nigricans and occurs due to excess insulin circulating in the blood, which stimulates excessive skin cell growth. While these patches can also appear due to obesity or genetic factors, when combined with other signs, they serve as an important warning for diabetes. 2. Dry skin and constant itching. Diabetes affects skin hydration in multiple ways. High blood sugar levels can lead to overall dehydration, which also impacts the skin's natural moisture. Additionally, poor circulation prevents the skin from receiving adequate nutrients and oxygen, making it drier and prone to cracking. This can cause constant itching, especially in areas like the legs, feet, and elbows. If you experience persistent dry skin even after using moisturizers, it may be a warning sign. 3. Wounds that take too long to heal. Cuts, scratches, or small wounds that seem to take a long time to heal may indicate circulation issues. In diabetes, excess glucose can impair the immune system's response and slow down the healing process. This happens because damaged blood vessels make it difficult for cells responsible for tissue regeneration and infection prevention to reach the affected area. If you notice that minor injuries take a long time to heal or frequently become infected, this could be a strong indicator that your blood sugar levels are not well controlled. 4. Frequent skin infections. People with diabetes are more susceptible to skin infections caused by fungi and bacteria. This is because high blood sugar creates a favorable environment for these microorganisms to grow. Fungal infections, such as cutaneous candidiasis, often appear in warm, moist areas of the body, like between the toes, underarms, and groin. Bacterial infections may manifest as boils, abscesses, or even cellulitis, which is a deeper skin inflammation. If you frequently experience infections without an obvious cause, it's worth investigating further. 5. Small reddish or yellowish bumps. This is a less well-known sign, but it can be a clear indicator that blood sugar levels are too high. Diabetic xanthomatosis appears as small raised lesions that are reddish with a yellowish center, typically found on the hands, feet, arms, and buttocks. These occur due to excessive fat circulating in the blood, a common issue in people with uncontrolled diabetes. These lesions can be mistaken for acne or allergies, but the key difference is that they tend to appear widespread and take a long time to disappear. These 5 signs can serve as warnings that your body is struggling to regulate blood sugar levels. The most important thing is not to ignore these changes and seek medical advice for a more precise diagnosis. How to distinguish harmless signs from more serious symptoms. The first thing to consider is the persistence of the signs. If a dark patch appears and disappears quickly, it may just be a temporary irritation. However, if it stays or grows over time, it could indicate insulin resistance. The same applies to wounds that don't heal. Small cuts usually heal within a few days, but if they take weeks or become infected easily, it's a serious warning sign. Another aspect to observe is frequency and recurrence. Occasional itching is normal, but if it's constant and doesn't improve with moisturizers, it could be related to diabetes. The same goes for skin infections. Having a pimple or a minor abscess isn't uncommon, but if fungal and bacterial infections keep returning, there may be an issue with your immune system. Finally, pay attention to other associated symptoms such as excessive thirst, fatigue, and blurred vision. When skin signs appear alongside other classic diabetes symptoms, the need for medical evaluation becomes even more urgent. If you've noticed any of the warning signs mentioned above, the most important thing is not to ignore them. Your skin may be signaling an internal problem, and acting quickly can prevent future complications. So, what are the next steps? Monitor your blood glucose levels. If you already have a diabetes or prediabetes diagnosis, keeping your blood sugar under control is essential. If you haven't been diagnosed yet, see a doctor for tests such as fasting glucose and hemoglobin A1C to check for any irregularities. Take proper care of your skin. Keeping the skin hydrated, avoiding very hot showers, and using mild soaps can help minimize dryness and irritation. If you have wounds that take a long time to heal, keeping them clean and protected is crucial to prevent infections. Adjust your diet. Reducing the intake of refined carbohydrates and sugars can help stabilize blood glucose levels, improving both internal health and skin appearance. Adding antioxidant-rich foods, such as leafy greens and berries, can aid cell regeneration and strengthen the skin barrier. Consult a specialist. Dermatologists can help distinguish common skin conditions from diabetes-related issues, while endocrinologists can assess if your blood sugar levels are out of balance. The sooner the cause is identified, the more effective the treatment will be. Skin changes can be a silent warning from your body about diabetes. Dark patches, dryness, slow-healing wounds, and frequent infections should not be ignored. Identifying these symptoms early can make all the difference in preventing serious complications. If you've noticed any of these changes, seek medical advice and start adopting healthier habits today. And if this information was helpful to you, subscribe to the channel for more content on health and well-being. Leave a like and share this with someone who needs to know. See you in the next video.